Hi, I'm Stephanie Shelton, and this is episode 47 of Conversations on Health, How We Get There. It's been nearly 3 years now since we had a conversation about heart disease, which sadly remains the number one killer of Americans, as it has been since 1921. It also remains number one in many other countries, but since we last talked about it, there have been huge advances in how heart disease, in its many different forms, is detected and treated. And I'll bet you can guess the reason. Exactly. It's AI. So I asked one of the best specialists I know to come back and help us understand how AI is already improving the practice of cardiology in its many specialties, and how quickly there will be more breakthroughs, many of these likely resulting in the prevention of heart disease as we know it today. Now, as you may recall from episode 20, Dr. Mohammadali Habibi is an electrophysiologist with the highly rated Valley Health and Hospital System in New Jersey, where he is director of its Ventricular Arrythmia Program. And before we got into the AI nitty-gritty, I asked Ali to spend a few minutes explaining how the late Senator Lindsay Graham, who likely had the best healthcare coverage in the country as a U.S. Senator, could have died so unexpectedly just a little over a month ago. Ali, welcome back. Thank you so much for coming back for the update.
Well, thank you for having me.
So before we go on to the hot subject everywhere, which is AI and the healthcare world, could you just answer me one question on Senator Lindsey Graham, who, as you know, died back on July 11th rather suddenly from what the medical examiner said was atherosclerosis, cardiovascular disease, but he died from a ruptured aorta. And I think that's frightened a lot of people because if you look at members of Congress, they've got the best medical care that could possibly be, and yet somebody as important as Senator Graham can just die. How is
Right.
that possible?
Yeah, good question. So I'm not an expert on aortic aneurysm, aortic dissection that looks like what he had. But and I don't know a lot more information about his personal medical history. But bulging of the aorta or rupture of the aorta can happen usually in people who have high blood pressure or may have predisposition to that by forming atherosclerosis, which basically are cholesterol or calcium plaques deposit in the aorta. Then that will be predispose them to rupture or forming bulging of the aorta. So I don't know what happened in detail in him, but often people who have a family history, if they have known risk factors for this condition, or they have their former smokers, for example, they need screening for this. But in the absence of those risk factors, usually screening is not recommended for this condition. So it's not like every person should be screened for aortic aneurysm. So majority of people don't need a screening. So usually you find it as incidental findings. You basically getting a CT scan or echocardiogram of your heart, and you see, oh, there is a bulging in the aorta, and that basically starts more workups or more tests, and then you will be under surveillance. Basically, once the size is above certain number, then
Right.
usually surgery is recommended. But in general, it's in majority of people it's incidental finding, and in some people who had, especially elderly people who were smoker in the past, screening is recommended.
All right. Well, we know nothing about his past medical history, so we'll just have to make an assumption that he was unique in a sense, as we all
Right,
are, and it's the rest of us that worry about stuff like that.
right.
So I think that's kind of reassuring. All right, let's move on. So the reason for this update is that it's been 3 years since we talked about electrophysiology
Hmm.
and what was going on. And in those 3 years, AI has become a huge, huge factor. So if you were to look at in a generalization, what AI has meant to you personally as a physician who has to make all kinds of decisions and made them on your own in a sense with the scans in your brain and your experience. What has it meant for you?
Uh, so, so So, as you mentioned, artificial intelligence or AI gradually, or actually maybe not gradually, or at a faster speed, is you can see that in your daily life,
Yeah.
or actually same in medicine, right? Uh, so I you can find AI implementation in medicine in many aspects of it, in day-to-day decision makings, and mainly in the diagnostic part, in the same as in the field of electrophysiology. Uh, it hasn't fully implemented, although you will see aspects of AI in different parts, for example, in diagnosis or in screening or in administrative parts, that is implemented, and it basically can help you to become a better doctor or become a better clinician. So if you want to uh, ask where AI is actually delivering value in medicine, you can divide it in different sections. For example, in diagnosis, you can have it used in imaging. So there are basically it is useful in the parts that you have pattern recognition, right? So AI is good when you give a lot of data. I give you an example. For example, in my field as a cardiologist or electrophysiologist, you can give 100,000 EKGs, and then you have something called machine learning. So that AI or the software analyze those 100,000 EKGs, and then you give it the data or medical data of those 1,000 patients. So you say they have their age, they have their gender, they know what type of arrhythmias they have, what's their life expectancy, or what are the other like heart failure they have, or other medical conditions. Then that through machine learning, AI can recognize patterns in their EKG that's associated with those type of disease. So now that you give them another EKG from someone that AI has never analyzed, can compare this with those patterns and suggest, oh, this patient or is at risk of this specific disease, or at risk of sudden death, or even you can sometimes find interesting data from interesting suggestions from it. For example, there was a study that they gave AI based after machine learning the EKG, and they can predict the age. So they tell you, oh, this is from a 45-year-old. I mean, it's something that you don't look at the EKG to figure out someone's age, but because of that pattern recognition, the AI could actually guess the age of this person who had the EKG. So
So
that's
you're
that.
talking essentially about something that would be in a diagnostic tool instead of waiting until somebody actually has a problem. They're suggesting that this person might have a problem. If you monitor them early, those problems might never develop because you might be able to change the telemetry in a sense.
Correct. That's one of them. So that's one of them is a screening or having a diagnosis earlier. You can have it in actual after, I mean, the detection of the disease too. So, for example, you can have one radiologist can read potentially, let's say, 10 chest X-rays in an hour, but you can have an AI doing that in 2 minutes or 3 minutes. So you can just need to have someone to cross-check it to do the validation. You can, in our field, for example, you can use AI in wearable watches to detect arrhythmias. So based on the patterns of the heartbeats or irregularity, it can detect some sort of arrhythmias, for example, atrial fibrillation or AFib, which is the most
Right.
common one in adults. Or you can use it for administrative stuff. For example, all of you have seen when you go to doctors, sometimes you may see a doctor is typing the notes as they're talking to you, or if they're not doing in front of you, when you leave, what that doctor does is basically sitting by the computer documenting what they have discussed with you, what you told them, what they recommended. So now you can have something in the room that listens to your conversation with the doctor and the ones automatically summarize what the doctor has recommended to you and what you have told the doctor. So by the time you leave, your note is already there. So you just need to go over it and then just make sure everything that you wanted to be included in that note is there. So basically can make you more efficient in seeing patients. So now you can just focus on your conversation with the patient when you're seeing the patient. Uh, so I think it's gonna help us to become better doctors, and it will help to have what may not be available for everyone in some underserved areas available to them with the help of AI.
So you think AI will, because this is a big issue. Obviously, if you have a doctor and he recommends you see a cardiologist or an electrophysiologist for something, you're in the system,
Mhm.
and there are millions and millions of people who have no system, who don't even have a doctor anywhere near them. Can and I guess we're talking about mainly rural health and the very, very poor in the big cities. Can this actually help people in ways that they can't access now?
I think it can. I think once you, uh, I mean, we are not there yet. I mean, I'm not talking about AI replacing a doctor.
No,
At least yet. I mean, we don't know
I don't
how
think
it is going. Right.
people
Correct.
don't want AI to replace a doctor. I
Correct.
mean, and
Correct.
they're
I'm
afraid
not
of
sure.
that.
Right. I'm not sure how practical it would be in terms of trust and in terms of liability, right? So you don't know who is liable when an AI making decisions for you. Uh, but uh, but I think by having AI helping you or some task you transfer some task from humans to AI,
Mhm.
you can have more human beings or more physicians or healthcare providers available to for those people who don't have access right now in underserved regions.
Well, that's kind of exciting. So we're on the edge of something that could be
Right.
really very, very much of a big deal for very underserved people now, which is good to think about. Because all
That's
we
true.
hear most of the time is not good things about AI in the sense of people being afraid of it. So
Right.
it's one thing not to be afraid of. In terms of what you actually are doing medically,
Mhm.
from what I read, there's a great deal of help in just dealing with atrial fibrillation, for example.
Correct. So, in terms of if you want to talk about how AI has been already
Yes.
affected our day-to-day work, basically as a cardiologist or electrophysiologist. The main one is detection of arrhythmias in patients who have a wearable smartwatch. So I see many patients who they had no idea they have arrhythmias. Now with the help of that the watch that they have, the smartwatch they have, they now are aware of having an arrhythmia. So it's number one. We do implant in many patients an implantable device to monitor their rhythm, or many patients do have a pacemaker or defibrillator, and all these patients are monitored, or most of them are monitored remotely. So AI can filter some of the noises that you would get, the false alerts, and just gives you the true one. So that basically decreases the burden of the doctors who monitors, let's say a doctor monitors like 500 people or 1,000 patients. So the AI can initially basically do the AI does the filtering. So the alerts that are not real, we can basically say, oh, this is not a real one. Let me just remove it and just give the doctor or the real alerts that you can just look at those. In terms of using ambient scribe, which I explained, we're already using it. So if you,
Right.
I'm sure if you go see some doctors, they may ask you for permission. Is it okay if you record your conversation? So the notes will be available to them. So that is something is already implemented in several institutions. Uh, Also, it has been implemented during procedures. For example, one of the procedures we do as an electrophysiologist is called catheter ablation. Basically, it's minimally invasive procedure. You go into the heart with the wires and then to figure out where in your heart that arrhythmia is coming from. So now with the help of AI, it can suggest you, oh, in this specific patients based on these tracings, from their heart, the arrhythmia coming from that specific region of the heart. So you can just go there and then look into that region or do the ablation in that region. So this is something was not available like a year or two ago. And now it is. Uh, so these are the things that I can come up in my mind that has been already implemented. I mean, 2 years ago, 3 years ago, when we had this conversation, none of these were available at that time. So,
It's amazing, isn't it?
correct. That is correct. Yes. Yeah. Right.
Do you, so here's my question as a layperson. Um, I use AI for my purposes also, but I don't fully trust the answers yet. Do you fully trust the answers, or are you still doing some of what you traditionally would have done?
Yeah, like many others, I also for sometimes for my day-to-day questions ask AI. So I do the same thing, and many times the answer is not accurate. And then when I ask the app that I use, oh, this is not correct, they always say, "Oh, yeah, you were right. It was not right. I didn't. I just didn't pay enough attention." So I don't know. Right, that is correct. So that brings the issue of the trust.
Yeah.
So I don't know how much we can say that how soon in future we can say, oh, we can be fully dependent on AI. So right now everything has a human cross check, right? So we haven't implemented AI in anything that we could say, oh, we just do what that says. Always is a human cross check. And I think in medicine you will be more, I'm sure, going to be more regulations and more verifications before implementing AI. But you're absolutely right. There are times that you ask a simple question and the answer you get is surprisingly not correct.
And in the sense of one of the procedures you do, the ablation, where you go in and try to turn off sources of the AFib when somebody has it, that was something you basically, not you personally, but you as the electrophysiologist did in the process of either studying the scans that you had before the procedure or within the procedure itself. But that's something AI can do as you, in a live sense, as you're doing a procedure. And they can literally tell you where to go. Again, is that something are you using it that way, and would you trust it?
Uh, there are the two ways that AI does it. One is you give them the data before entering someone's heart, and it tells you where that specific arrhythmia is coming from. And that you can validate, right? So it tells you, oh, it's coming from that region. And sometimes you can go to that specific region and then see if they're correct, it was accurate or not. Also, you can do it as you're collecting the data. It goes through their AI system and it suggests you whether those are the regions of interest to target. Uh, there are, I mean, the way that I trust or not trust those is, I mean, you basically come from data, right? So in medicine, always any intervention, any drug, any system always has to be proven to be effective before implementation,
Yeah.
right? So you do randomized clinical trials, you show that this is safe, you show that this is better than what we have, or at least non-inferior to what we have, and then you implement that in your day-to-day practice. So it won't happen until those are done. We have some data preliminary data and some smaller studies, in some of them showing that they're beneficial.
So, of what you've discussed, at this point, from a patient standpoint, what would you say is are the wearables the most important feature of where we're going, or is it in the procedures that you do, or from a patient standpoint, what's better for me today than it was 3 years ago?
You're talking about my field, right?
Yeah.
Yeah, electrophysiology. Yes. When you're talking about from patient's perspective, you basically talking about what is available for many people, right? So ablation is a minority of people need a procedure, right? So if you're talking about the population health, then you should talk about what is available to in the population level, right? So in terms of the population level in my field, electrophysiology is basically wearable devices has had the highest impact. The fact that you can detect arrhythmias by a simple watch, which was not the case 5 years ago or 10 years ago. You can record your heart rhythm. You can have some sort of system that can filter them and can screen them for arrhythmia. So that is the biggest change. The reason for that is it's available to many people.
Well, but
Uh,
okay, it was available. I mean, I've had an iWatch, an Apple
right.
Watch now
Yeah.
for, I
Right.
don't know what, 6, 7 years. It's been able to detect, it says very clearly we're not a medical thing, but you might
Correct.
want to
Yeah.
talk to
Right.
your doctor
Right.
about this,
Yeah.
or
Right.
you might not. You don't have a
Right.
problem. But so that part of it's been available. Is it better now?
Uh, so I'm not sure about the specific, like, for example, Apple, is it better or not? So because they don't, I mean, I'm not aware of their
Yeah,
algorithm.
right.
Has it changed or not? But the medical devices have better algorithms now. I'm not talking about those who are commercially available, but
Right.
medical devices that, for example, implantable devices that you insert under the skin for this purpose, for continuously monitor someone rhythm, their algorithm has been improving over time by time in detection of arrhythmias and filtering out of noise and unnecessary alerts. So that has been changing. There are studies showing that they have been able to decrease false alerts and have improved the detection of the arrhythmias by implementation of the artificial intelligence.
So in general, are we moving toward and we talk about 3 years ago, we weren't talking about this stuff. And 1 year ago, it wasn't as widespread as it is now. And 2 years from now, where
Mhm.
is it going to be? Are we talking in general that if because heart disease is still the number one killer in our country and in most countries in the world, are we talking about a situation where very shortly we may be able to cut that rate in maybe in half, who knows, but way down, way back by preventing people from getting to the point where they're almost dead to begin. By the time you see them, it's too late to do anything about it.
Yeah, that's the hope, right? So if you can, I think when you're talking about the population health, always investment should be in prevention, ideally, and early detection, right? Rather than end stage, waiting for until it advanced or end stage, right?
Right, right.
So I think you can see the potential in using AI in screening people, or finding those who are at high risk for developing a specific disease, and then screening them and finding those who are at risk or at early stages of a disease where otherwise they would have been missed if you would just rely on humans. So hoping that you can bring down the burden of the cardiovascular disease on an economy, basically, and also on the healthcare. So So I think you can use AI or can see the AI as a guide or as a help. I mean, not as a guide, but as a tool to achieve that goal. Absolutely.
All right. Well, as a sort of wrap up for this in terms of an update, what would you personally as a operating physician, I mean, you're working, you're dealing with people all the time, and you're having to learn how to use the AIs that are now part of your job in a sense. What would you say you're looking forward to, and where do you think you're going to be in terms of your job, say 5 years from now?
Well, it's hard to predict 5 years from now because with the speed that things changes, 5 years looks like a long time now, right? Maybe if you would ask it 10 years ago, easier to answer than now. That is the speed of the change that you can see. But uh, I'm expecting to see better for procedure wise. I would see that AI gonna help us to do the procedures safer, the safer, and also to make them more successful, especially in conditions that we haven't. I mean, there are conditions that you can see the treatment hasn't, the advance in treatment hasn't changed the outcome much. So in those fields, you can find AI as a big help, potentially as a big help in future to make the procedures more safer and also more successful, and also in detection of the disease at earlier stages. I can see that we'll have more softwares that can help us to detect people who are at risk of a disease, not just arrhythmia as a risk of sudden death, for example. That's a big field in medicine that we don't really have a great tool that can identify those who are at risk of sudden cardiac death and then prevent them from dying, because all algorithms, all guidelines are not perfect. So you can still follow them and still someone can die suddenly. So if you can, with the help of AI, you can detect those patients who are at higher risk and treat them differently or do procedures or things that can prevent them from dying. That would be amazing to save basically more lives.
So you personally, as a physician with a lot more years to practice, are you looking forward to what you're talking about? Do you see the future for you and your specialty and cardiology in general as, so many of us fear the future. Are you looking forward to it?
Oh, absolutely. I think future is much better than what it is now in terms of in healthcare.
Yeah.
It has been better. I'm not talking about the population health or in a
Yeah.
specific country, but the treating disease will
Yeah.
be much better in future than what it is now, as it is much better now compared to even 10, 20 years ago. The field will advance and we will be able to treat conditions that we cannot treat now, or we cannot treat as good as we will be in future.
Well, that's a great note to close on and make us all feel good about the future. And thank you, Ali, for
Oh,
coming
thank you.
back. And I'll talk to you again in a few weeks at the rate we're going.
Or thank you. Thank you. So thanks for having me.
Thanks, Ali.
Take care.
Dr. Mohammadali Habibi is an electrophysiologist with the highly rated Valley Health and Hospital System in New Jersey, where he's director of its Ventricular Arrythmia Program. So, next month, with the kids back in school and hopefully fully vaccinated, episode 48 will be all about vaccines, how they're manufactured, why they're so important, especially for babies and school kids and pregnant women, and anyone immunocompromised or around people with weak immune systems, and older folks, most everyone. We'll be talking to Dr. Anil Dutta. He's a pediatrician by training and an immunization expert with decades of leadership and executive experience in the pharmaceutical industry, including management roles at GSK and Sanofi Pasteur. Dr. Dutta is now the director of Vax Science, a Belgium-based vaccination education and consulting service. Episode 48 will drop on the third Tuesday of September. And as you know, I schedule one new podcast episode a month. And if you enjoy the podcast, please follow us or subscribe and, of course, share. The video is on YouTube, audio on Apple, and wherever else you get your podcasts. Show notes and links on my website, stephanieshelton.com/conversations. And you take good care of yourself and all those you love, and I'll see you next time. Conversations on Health, How We Get There is produced and edited by Frank Harold. Research assistance from Dr. Richard Saltman, Professor Emeritus of Health Policy and Management, Rollins School of Public Health at Emory University in Atlanta.